Thank you, Adam and Siobhan. If we can get the speakers to come up to the front, we have been asked to stick to time, which means we haven't got much time left, but we will try to get through a question or two. And I think the sort of top voted question on Slido, which I think is a good one actually for all of the speakers, and maybe we can get a quick answer from each of the speakers on this question. So, many methodologies discussed put a dollar figure on social value. Isn't there a danger that this keeps us as a society focused on financial outcomes rather than social outcomes? Who'd like to take that one on first? Great if we get a short answer from all of you.
Shall I have a go?
Sure.
So we do quantify well-being with a pound sign, a dollar sign, depending where we're working with. I think it was articulated nicely by another speaker in terms of the fact that that gives us some sort of understanding when outcomes are quantified consistently of actually the relative importance of those outcomes to people. The most important thing for me to remember when we're using our methodology and when we're helping practitioners use our methodology is that a financial proxy on a well-being outcome is just that. It is a proxy for well-being. So we might be putting a currency sign in front of it. It doesn't represent real money. It represents well-being. And if we keep that in mind and we ensure that we are driven in our behaviors with that in mind, we can avoid falling into the trap of making it just about money.
We talked about it at breakfast. We could measure it in kisses was our revelation. But what's that going to, how does that help you? How does it help the world connect to it? And so for us, I actually think the outcome is it's a ready mechanism for allowing trade-off. So it actually has a method. I think there's also the stack preference model actually, it does reveal you're using dollars to say what else would you want. So it allows for preference swapping really well. And ultimately, I think that's kind of, it sets it up as being a far more useful measure than kisses. But happy to have some other measure of well-being as a commonality. But dollars has probably a little bit more utility in it.
Thanks. Cressida?
This is something that really worries me. I think money makes people do things. Great. Carbon pricing can make people do things. Excellent. I do want to say that the kind of money representation that I was talking about in something like ETH isn't about putting a dollar value on well-being. It's literally just about accounting for the real costs that are going to accrue, or the real savings that are going to accrue government. So it's not saying that that's the only way of getting well-being. It's just saying that here is something where when you say it's too expensive to invest in something that would improve the well-being of the people, budgets are really tight. You often hear people say, wait a second, if we invest now, we're going to be genuinely saving a huge amount of money over the future. Like, it's not bigger, broader fiscal effects. It's not saying, hey, if I spend this money, I'm actually going to get all of this extra value. I sometimes feel like, this dress is on sale, it's 50% off. I've just saved $100 by buying this $100 dress, right? This, very, very specifically, there are things that governments aren't doing which are really basic, which isn't even about measuring well-being. It's just about accurately representing costs, but inaccurately representing them is getting in the way of us making good policies that either improve well-being, or it's overemphasizing the value of bad policies that are actually undermining well-being.
Thanks, Cressida. Siobhan, did you want to add anything?
I would just sort of expand a little bit on the previous comments to say that as long as you're disciplined in what you're doing and that you're providing some sort of rigor over the drivers, the proxy doesn't matter. And even when we worked with Westpac to develop our sustainability linked loan, I think our second party provider didn't really care what the dollar figure was. It was what activity is going on in your business to ensure that those drivers, whether it's more hospital beds or more people receiving care, more permanency for your employees, what are you doing to drive those outcomes? The dollar figure doesn't matter.
Thank you. There's a question here. We're just about out of time for questions, by the way, unfortunately. But I really encourage people to come and talk to everyone. You know, as with most of the speakers here, everyone's really happy to talk about their stuff. So, you know, come and talk to people, you know, introduce yourself. Maybe one last question for MK, which is very relevant to Australia and the sort of current housing crisis that we have here and the poor rental rights that we have in Australia is, it says right here, you know, this impact of mould on child health is a huge problem. We have a crisis of affordable rental availability and few tenant rights. What did you learn in the UK about how to fix this problem?
That's a big question. So I guess what I'd say is that case, I wish I could say it was isolated. It wasn't. It was high profile because a child died. But it wasn't an isolated incident. What happened afterwards, as you would expect, was that both the chief exec and the chair of that particular housing provider resigned, as they should have done. It triggered a wide scale, obviously there was a coroner's report, and it triggered a wide scale survey into housing condition in the UK. And unfortunately, what we found was that with that wide scale survey, 80% of homes were found to have some level of damp and condensation, keeping in mind we live in the UK in quite a damp climate. My house has some damp. So some level of damp is quite broad, but really critically, sector-wide, over 160,000 homes, we found that 8,000 homes in the UK that were part of this survey had damp and mold that was considered so severe that it posed an immediate health risk. 8,000 homes. Obviously with children living in those homes, vulnerable people living in those homes, people with existing health conditions living in those homes. And as a result, there is what is known as Awab's Law, which has been written into the Social Housing Regulation Act 2023, which extends specific rights to renters in saying that they should have a 2-week remedy period for cases of severe damp, mold, and condensation, which is something that renters didn't previously have. I think it's a shame that it took a child dying to get there. It sounds very sensible that if you live in a home that has severe damp and condensation, you should have remedy via your landlord. But that is what is now being written into regulation as a result. So I'd like to say that it would have been done sooner, but there were lessons learned.
Thank you. I think we've managed to keep to time. It's 2:15. Sorry that the panel section was so short and that so many of your questions went unanswered, but please join me in thanking our panelists and speakers.